So one other thing that I want to point out with respect to granulomas is that granulomas can also occur at the exit site of the stomach, where the stomach empties into the small bowel. It can show up in infancy, and it actually, harking back to signs that you should say, gee, does this child have CGD? And I forgot to mention it earlier, but it's important to say at this point, is that sometimes an infant can show up with pyloric outlet obstruction, fancy way of saying food isn't going down from the stomach and they're throwing up. If that is the cause of the throwing up, and an infant is shown to have a pyloric outlet obstruction, a CGD test should be used. But in older little boys and girls, a common thing that happens is that they complain they've got a stomach ache, an hour or two after they've eaten. And some of them may even throw up once a week or once every other week. And people wonder, what's with the CGD patient who's throwing up once a week, or why aren't they throwing up every day? And the reason is they have only partial outlet obstruction. And it kind of depends on what they eat and how they feel and what's going on. And so they may only rarely throw up. Or they may not throw up at all. They just may feel, how should I put it? Just have an ache in the center of their stomach, literally every time they eat a big meal. Those patients probably have physiologic problems emptying the stomach. And a lot of time and effort is often wasted on trying to figure out what's wrong, when all they need is a short course of steroids. And maybe it might be a child who needs to be on low dose alternate day steroids, and then they feel better. Sometimes, it's blamed on some little kid who doesn't want to go to school, and so they're saying they've got a stomach ache all the time. Don't dismiss it. It could be this pyloric outlet obstruction.